So Dr. J, considering that poor nervous system health relates to so many things that we're all experiencing, anxiety, immune issues, cancer, digestion issues, pain, reproduction, why is nervous system health so neglected and untreatable?
So this is a great question. And this is this kind of goes back to why I went into medicine in the capacity that I did. Our current medical system, at least in America and in most Western societies, is highly, highly specialized into their little tiny corner. And they do that really well, but that's all they do. And they have these treatment algorithms that if something falls outside of that treatment algorithm, they just kind of throw their hands up and say, we don't know, idiopathic, or pass them on to the next specialist. There's very few people who really zoom out and take a global approach and say, okay, so you have this neurologic issue, but then you also have all these other things. What's the underlying cause from a global perspective? How do all of these little parts come together to make you as a whole person? How's it all functioning? And that's really any holistic provider, whether, an integrative practitioner or whoever you are, an integrative provider or a holistic provider will look at that. Like, how are all of these pieces put together? And that in and of itself has become its own specialty of holistic medicine. And so I think that's a huge part of it, is if you go to the gastroenterologist, because you're having digestive issues, reflux, gas and bloating, diarrhea, constipation, whatever, nausea. They're going to do a bunch of imaging, some labs, work you up. If everything looks normal, they say, from our perspective, you're normal, take this drug, try it out, see ya. They're not going to really look at unless somebody's had a lot of surgeries and they know there's nerve damage in their gut from surgeries or something. They're not even really going to think about how the nervous system is affecting the digestion, because they're focused on the digestive organs. You could say that about pretty much everything. And so especially when it's these sort of free floating, questionable, not easy to tack down diagnoses, it just, even an infectious disease specialist, they're looking at specific infectious agents. That's it. They're not looking at, why is the immune system getting all these infections? Why is this person not clearing the infections? They will, to a certain extent, look at the genetics, et cetera, but they're not going to say, it's rare. I think it's getting better in medicine that people are at least asking about stress, but it's drastically overlooked. They want to get, even with cancer, obviously I work in oncology, and they hardly even oncologists almost never even ask their patients,
it's crazy,
what's your home life like? What's your stress levels like? How's your diet? It's like, this is what the drug we're going to give you. You got to get the surgery, chemo, radiation, immunotherapy. We got to try all these. They don't focus on the root person, and the other issues at hand and kind of root cause. What's your trauma history, et cetera. So that is the job of an integrative provider, somebody who's looking at all the different pieces and putting them together. I really do think that why this is not getting covered, a good primary care might sort of catch, there are all these pieces free floating. Sounds like stress could be underlying a lot of this. But most primary care physicians that are not integrative in some way in our country get 10, 15 minutes with the patient. They don't really even have the time to go into it. My visits are an hour to an hour and a half, sometimes longer, because in order to get to all of those pieces, we have to really talk. I have to really listen, and I have to have the space. And that's just not the model that we have in our country. So it's very easy to overlook the big stuff.
Yeah, so I think from a time constraint, I understand, right? Because when I work with people with anxiety, it takes time to really understand things and to work with people. You definitely can't get that done in 15 minutes. But I think from like a study and a practice perspective, it's confusing to me why the most advanced country in the world, looking at something as important as medical care, would not want to or be incentivized to look at the root cause of what's happening. If your organ is causing something, that's one thing, but if the underlying cause of that is your nervous system, that's kind of what needs to be dealt with. So I'm just confused about why that would be.
Well, the other reason is research is focused on treatment primarily and finding novel treatments, novel therapeutics. Mm-hmm. That's what gets money for research, is essentially, without causing a trigger word, pharmaceuticals and other interventions that can make a company a lot of money. And prevention, there's no money in prevention. This is a huge problem. Insurance doesn't even pay for preventative visits, or maybe one a year. So to prevent something, it's not incentivized in our current model in healthcare, being a for-profit system. Same with, if a neurologist says, I think your nervous system's dysregulated and stress is at the root cause. Well, what are they going to do? What are they going to throw at it? Because they have to be treated. Once you have a diagnosis, there's a treatment. And the whole point in modern medicine is to get a diagnosis so that you can get a treatment, an FDA approved therapy. So there's nothing pharmacological that deals with stress. There are, of course, SSRIs and other psych meds, anxiolytics like benzos, et cetera, that can help with stress, anxiety, depression. But again, if the stress and anxiety and depression are caused by this underlying stress or trauma in childhood or something else, you're just treating the symptoms. Yes, you're treating the nervous system in that case, but you're still treating the manifestations of an underlying issue that might be decades old. And so if they don't have an FDA approved therapy, a conventional medical practitioner isn't even really going to, there is an ICD code for stress, but it's not something that can be treated easily with drugs or at all. And so they might say, oh, do some deep breathing or go see a therapist, but they just don't really have the tools, and it's not really the focus. And same with research. I mean, there's a ton of research on adverse childhood events and how it relates to health, et cetera, global health, but they're mostly epidemiologic studies. It's not treatment-based studies. So it's really just the way our healthcare system is stacked against prevention and non-pharmacologic interventions for.
So stress is such a big, and it's so interesting because every time I talk to doctors who really care and have gone outside of their traditional training to understand the problems, they come back to the same thing, which is that, like you said, without using a trigger word, big pharma is dictating the research, and that's heavily incentivized by specific things that are looking to treat symptoms and not necessarily like the underlying cause. But if stress is such a big causative factor, why isn't there something pharmacologically developed to treat that specifically outside of SSRIs?
Because it's so multifactorial. Pharmaceuticals want one molecular target. They want to hit it really hard. They want to do just that one thing and overlook everything else. In fact, if a drug has multiple molecular targets, it's considered a dirty drug, and it's less favored in medicine in general. So because the effects of stress are so far-reaching, hormones, brain, nerve health, pain, psychiatric manifestations, immune manifestations, all over these global digestive, because there's so much going on, and because the nervous system is so highly complicated, so many neurotransmitters, presynaptic, postsynaptic, like it's so complicated that I feel confident in saying there will never be a one and done pill that has that broad reaching effects with one molecular target. You're just not going to get it. Even most of the psych meds that work the best have a bunch of molecular targets, and they're kind of just well, maybe one of these is going to be effective. And maybe not, but we're gonna kind of just throw whatever we can and hope that one of these targets is going to mitigate the symptoms. So yeah, it's not possible to do with a drug, at least not at this point. I mean, even all of the herbs that we use for this, adaptogenic herbs to balance the effects of stress, they have effects on the hormonal axes, they have effects on the nervous system, they have effects on the digestive system, improving your digestion, improving vagal tone. Like, they're doing so many different things. If you looked, the actions are like dozens of them, and they do all of those very gently. So over time they build up and work, but you just can't have that effect with one
pharmaceutical drug.
One molecular target. It just doesn't work that way.
Yeah. No, I was just smiling as you're saying this, because I know that it sounds a little depressing to hear that, like, pharmaceuticals don't have one drug that can solve it. But it's also exciting to me because, as you and I have gone through our own journey with nervous system health and been frustrated with what the medical world has to offer, that's what led us to developing LUMNA, which I'm going to talk about in another question when we get into more detail. But it's amazing because, sometimes people think that plant medicines or herbal medicines are not as strong as pharmaceuticals. But in this case, this is exactly why those are working more effectively than pharmaceuticals can, because a plant medicine can treat multiple things when, like you said, pharmacological things are focusing on one very specific thing. Plus, there's a number of different things. So that's a juicy question I'm going to get to shortly.
Yes, exciting. Good.